Hello, I am Jessica Perry, and I am a MLT attending Winston-Salem State University. Today I'm going to be speaking on the efficiency of cold stored platelets and their future comeback to healthcare. Cold stored platelets were abandoned in the 1960s, and room temperature platelets were in favor due to long post transfusion recoverability and the survival in patients with chronic thrombocytopenia. Today, more platelets are given to patients who are actively bleeding, especially the ones receiving cardiac surgeries. Cold stored platelets offer the advantage of improving clotting and hemostatic effects. In this presentation, I will provide information on how cold stored platelets should make a comeback and be beneficial for the future. Physicians will order platelets intended to transfuse, but for some of us blood bankers, we all know the chance of that happening is slim to none. The good thing about platelets is that they are not type specific, and you will try to give them away to another patient in need if possible, but you still have a chance of a product being wasted. Reinstating cold stored platelets back will have a great outcome for hospitals by helping save money in the long run. These platelets will reduce wastage rates due to having a longer shelf life. They also will have a safer for transfusion due to reduced bacteria by storing them at a colder temperature, which is 4 degrees Celsius instead of room temperature to 22 to 24 degrees Celsius. Cold storage platelets do not require mechanical aggregation due to storage. This will also eliminate the cost of mechanical shakers being needed in blood bank, and it will help improve the shipping. The effects of cold storage platelets are currently being investigated due to the cold temperature causing the platelets to kind of lose their shape and have a change in the different surface receptors. But that is being approved by having platelet additive solutions added to the cold store platelets, which is going to help them have a longer shelf life and be safer for the patient and providing in vitro transfusion efficiencies. However, there are limitations to this technique. Cold store platelets may lead to changes that improve platelet aggregation, but also increase platelet adhesions. This will account for a decrease in vitro survival of platelets preserved for transfusions of cold temperatures. In certain emergency situations, cold store platelets will be very valuable for treating bleeding patients who have inflicted serious injuries. In certain emergency situations, such as the military or any type of pre-hospital environment like accidents and shootings, these platelets will help assist the patient more with clotting than room temperature platelets. Currently, there are no risk of cold store platelets. We're hoping that none are developed, but they seem to be very safe for the patients in transfusions. Um, there continues monitoring of patients who undergo cardiac surgery. However, the recovery process is for those who are transfused with cold stored platelets. Vital sign monitoring, such as your blood pressure, your heart rate, and other oxygen saturations, are very important for patients' response to this transfusion. All of that is monitored. The platelet count is monitored. The effects of the cold store platelet transfusion, certain coagulation monitor is very important. PTT should be monitored before and after all transfusions. Um, with these methods that that need to be undergone. Um, Clinical trials have been proven. Um, they consist of patients, such as volunteers, of course, who undergo antiplatelet therapy, showing post transfusion of cold store platelets compared to room store platelets. Um, for the future directions are improving quality control. This will include development of new methods for monitoring platelet ag- ag- aggregation and lead to a better understanding of how to optimize the storage and use of cold store platelets. In conclusion, cold store platelets are a promising technique that has the potential to improve quality and safety of blood transfusion. It will continue a growth of not having wastage, saving hospitals funding, and provide just quality care for patients in the future who need platelet transfusions. This form of transfusion will continue to be safe. Room temperature platelets always can carry such amount of bacteria during transfusion. With this method, we can reduce some of the contamination that platelets can have and just provide so many other benefits to the patient as well. By funding my project, this research will help save the hospital a lot of money being wasted and continue to provide good care for their patients. I just want to thank everyone who supported me and who gave me the courage to continue to pursue this degree, to pursue this research. And I just want to thank all my supporters who helped me at this time. Thank you.